All right, thank you, Chuck. Well, it's time for a new segment here called 25 News Doctors on Call, where we talk about the latest health news and you get your answers to health questions from a doctor live right here in our studio.
And we've been talking about this for a few days. Today's the day we do it. So welcome to Dr. Douglas Casper from OSF. He's also head of infectious disease at the University of Illinois College of Medicine in Peoria. He's been a busy man for about 3 years.
Yeah, thank you for having me.
All right, well, Doc, we're getting into the cooler months. We're starting to hear more coughing, the sniffles in the newsroom. What are you noticing so far this season with the COVID, flu, colds? What are you noticing?
Yeah, certainly we're going into respiratory viral season. COVID is predominant right now. We are not seeing much of any influenza yet, but that will be here by December going into the spring. RSV has been noted in the southeast portion of the United States, and it will be in our area soon. So now is the time to talk about vaccination.
All right, well, we have some viewer questions that we want to get to. We're going to be talking about the vulnerable population. Makitza Johnson from Bloomington, Illinois, her question is, should people who have asthma always wear a mask to reduce the risk of catching airborne viruses?
Yeah, this is an interesting question. Masking has become a very individual decision. Masking definitely protects in those situations where you're around unknown people, potentially traveling, maybe going across the country for the holidays. The interesting part is that masking does protect against all three viruses, influenza, RSV, and COVID. Now, unique to this question, we always thought that respiratory infections, including asthma, would make COVID infection worse in the patient, but asthma wasn't really seen like COPD or emphysema or other conditions. So masking, it's not universal anymore like it used to be, but if somebody feels that they're at high risk, it does protect against all three different infections.
Okay.
We have noticed some people lately coming to work wearing a mask if they don't feel good. That's still the right move, right?
Yeah, certainly if you're recovering and maybe you didn't get to get tested, masking provides protection for you to return to work for those that you may be around at work or at home.
We certainly appreciate it when we see it.
Yeah.
All right, let's get to another viewer question. This from Cindy Brown out of Normal. What medications does Paxlovid have interactions with? And you can use this to treat COVID.
Yeah, Paxlovid is the oral antiviral medication available for COVID. The good part about answering this question is that Paxlovid remains a prescription medication, so both your medical provider and the pharmacist will help check for medical drug interactions. As always, the patient should make sure that their physicians are aware of every medication they're on, because Paxlovid does interact with heartburn medications, blood pressure medications, and others, but the patient themselves doesn't need to worry too much about looking into it.
Okay, I think we have one more question to get to from Patricia Thompson in Bloomington again. She says, 2 years ago, I got my third COVID shot and my flu shot. A few days later, I had a mini stroke. Now it's time to get them again. I'm nervous because I don't know if me getting those shots together caused my stroke. Is it possible that getting them at the same time may have caused my mini stroke?
Yeah, without knowing her or her medical history, it's hard for me to answer. What I will say is COVID vaccines have been given to hundreds of millions of people across the world. The CDC and FDA document all adverse effects, which remain extremely low. But a good answer to her question is there are other options now for vaccination, including non-mRNA vaccines. So Novavax, which is more of a traditional vaccine like we're used to for influenza, is now available to anyone who may have felt that they had an adverse effect with either the Pfizer or Moderna option.
Do you see people still hesitant to get those shots or more confident?
Hesitant because now the number of vaccines has increased when you put in seasonal influenza, RSV for those 60 and older, and pregnant women ages weeks 32 through 36, and COVID. I think people just have difficulty figuring out the sequence, but work through that with your medical provider, because when you get sick, it's very difficult to tell which of the three you could come down with.
Okay.
We found that ourselves too, with folks here wondering if maybe they had COVID. Instead it wasn't. It was just a typical cold, but there is a lot going around just right now even.
Yeah, and we're going to see more. Our traditional season for influenza is December until about April. RSV in our pediatric population, which is the main driver of hospitalizations over the winter, starts right about now. And we still see COVID, not as much inpatient, but still in our highly vulnerable population.
All right.
No
Thank you,
doubt
Doc.
about it. Thanks, Dr. Casper, for being here. Our next edition of 25 News Doctors on Call is about a month away, November 30th. It'll be right here during the 5 o'clock show. And remember, if we didn't get to your question this time, we encourage you to keep submitting them for our next topic of the month. We'll do our best to get you an answer.
Yeah, next month's topic will be food safety during holiday season. We'll be accepting viewer-submitted questions until Thursday, November 23rd, so you can start getting those questions in now.